How do medical professionals recommend that you treat your low back pain? Well, considering past experiences that you might have had, well, the answer might surprise you. Hey folks, I'm Dr. Jeff Williams, and I'm the orthopedic specialist here at Creekstone Integrated Medical, and I want to talk about what the medical industry says that you should do when your back hurts. When our backs hurt, for many folks, well, the first thing that comes to mind is to go to the doctor's office and see what can be done for it. Maybe some painkillers or muscle relaxers, right? Especially if it's awful back pain, the kind that keeps you in bed and you're not able to be active. You can't get out of bed. You can hardly even make it to the bathroom, right? The pain that almost makes you sick to your stomach. Some of you know what I'm talking about. Now, one of the leading causes for emergency room visits is back pain, believe it or not. In fact, low back pain is one of the most common reasons for all physician visits in the United States. Most Americans have experienced low back pain. They say approximately a quarter of U.S. adults reported having low back pain lasting at least one day in the past 3 months. That's almost a quarter of the nation. Pain is categorized as acute, which is less than 1 month in duration, subacute, which is from 1 month to 3 months in duration, and then chronic pain, which is lasting longer than 3 months. Most people don't understand that chronic pain is a little harder to get rid of, right? And it turns chronic at only 3 months. How many of you have had pain for more than 3 months, right? So anyways, primary care physicians, they're also known as your family doctors, they see a lot of back and neck pain as well in their clinics. Some are better at musculoskeletal pain than others, but in general, healthcare providers cannot be expected to be experts at everything. That would be unfair to expect all of us providers to be experts at everything. They just can't. It's impossible. So many family doctors are experts at, let's say, cardiology cases or stomach issues. Some are experts at diabetes and weight loss, while others are absolute experts at infection and lab work. But it is exceedingly rare, if not basically impossible, for a single provider to be an expert at all of them. Plus, in addition to all of that, being experts at neuromusculoskeletal issues. It's not possible. Now, for that very reason, medical associations and organizations, they convene through committees and boards. And what they do is they get together, they generate the very best recommendations based on what the body of research and evidence tells them. Well, these recommendations and guidelines make life so much easier for the general medical practitioner in the field, those that are expected to make good, effective recommendations, but are not experts in certain areas of medicine. Not to mention other ancillary providers like chiropractors, physical therapists, and providers like that. Now, with that being said, let's talk about what these big organizations now recommend for effective treatment of low back pain. The American College of Physicians, also known as ACP, these are the recommendations that they make for back pain. First of all, what is the ACP, or the American College of Physicians? They say with 160,000 members in countries across the globe, the ACP is the largest medical specialty society in the world. The ACP's clinical practice guidelines are developed through a rigorous process based on an extensive review of the highest quality evidence available, including randomized controlled trials and data from observational studies. The ACP, they updated their recommendations in 2017, so fairly recent. These are new recommendations, basically. And they say that their recommendations are an evidence-based clinical practice guideline, and they published it in the Annals of Internal Medicine for medical providers to be able to follow confidently. So here are the key recommendations. For non-pharmacological, non-medical treatment, including superficial heat, massage, acupuncture, or spinal manipulation. These should be used initially for most patients with acute or subacute low back pain. Let me say that again. Non-pharmacological treatment, first-line treatment for back pain, according to the American College of Physicians, includes heat, massage, acupuncture, or spinal manipulation. Okay? Those should be used initially for most patients with acute or subacute low back pain. Here at Creekstone, we have all of these first-line therapies available. When pharmacologic treatment is desired, non-steroidal anti-inflammatory drugs or skeletal muscle relaxants should be used. Again, here at Creekstone, we have a medical provider for this very purpose. Then they say non-pharmacologic treatments, including exercise, multidisciplinary rehabilitation, acupuncture, mindfulness-based stress reduction, Tai Chi, yoga, motor control, passive relaxation, biofeedback, low-level laser, we got that one, cognitive behavioral therapy, or spinal manipulation should be used initially for most patients who have chronic low back pain. We have several of those very services available right here at Creekstone. And the reason is because I wanted everything that the American College of Physicians recommended available for you right here to the Texas Panhandle, right here at Creekstone Integrated Medical. And we've got everything that we can do responsibly and that we are licensed to do that they recommend, we offer right here in one place. And for the rest of it, we know where to send you. Like for the mindfulness and the cognitive behavioral therapy, we know where to send you. Now, they say for patients who have chronic low back pain and they don't respond to non-pharmacologic therapy, NSAIDs should be used. Tramadol or duloxetine should be considered for those patients who do not respond or do not tolerate NSAIDs. Now, the next big, huge organization is the American Academy of Family Physicians. This is their recommendations. The AAFP, American Academy of Family Physicians, is the National Association of Family Doctors. It is one of the largest national medical organizations with 127,600 members globally. The AAFP updated their back pain treatment recommendations just in 2017 as well. And what they did was basically backed up the American College of Physicians, and they supported the recommendations of the ACP. So let's just say it. Two of the largest medical organizations, okay? We just covered them. And we got to think about it. Now, many times patients, they tend to discount certain things they are told by providers. And sometimes they don't trust what a family doctor tells them because a different family doctor didn't take good care of their mom. Or they don't listen to what a chiropractor or a physical therapist recommends because a chiropractor or PT didn't help their sister when their sister's back was hurting and they ended up having surgery. And all of that is understandable, but let me make a couple of points on this. There are no guarantees in healthcare because there's simply too many variables to a person's pain. Everybody's different, every injury is different, and everybody heals differently. And just because medicine, PT, or chiropractic, or whatever it might be, didn't help you or a loved one in the past, well, that doesn't mean that these cannot help. Sometimes we just need a different provider with a different set of skills. And remember, again, no single provider can be an expert in everything. Don't depend on your personal biases or experiences when the experts in the field have already done the work. Okay? They've already given you guides to tell you what you should do, what seems to be effective. Now, whether you've had back pain for 2 weeks or 20 years, the largest medical organizations in the world have solved the puzzle for you and have recommended you treat with an evidence-based integrated clinic offering an evidence-based chiropractor in conjunction with other providers like medical services, acupuncture, exercise, and massage. And it's just that simple. I mean, we can make it hard. It's just not. It's really simple. So now that you know what to do for back pain, why don't you call us here at Creekstone Integrated Medical at 806-355-3000, where you're going to be diagnosed by a fellowship-trained orthopedic specialist, the only one in West Texas all the way down to Mexico, folks. You'll be provided and coached through very targeted exercises for your pain. And then you're going to have medical services, low-level laser, spinal decompression, massage, and acupuncture all available to you should you want to use them. All right here, one place under one roof, all of us working together. When we all work together, the patient wins every time. Now, there are imitators, but there is only one Creekstone, folks. The first fully integrated clinic in the entire Texas Panhandle. So why don't you call us? Again, it's 806-355-3000. We can help. Again, I'm Dr. Jeff Williams. Until next week's video, stay smart and healthy. We'll see you then.